Hello everyone and welcome back to Banana Life. Today, we're diving into an important topic that affects half the population, but isn't always talked about enough: women's health concerns. Specifically, we'll be discussing menopause, PMS, and a range of other issues that many women face. Understanding these topics can help women take better care of their health and well-being. Let's get started. Menopause is a natural biological process that marks the end of a woman's menstrual cycles. It typically occurs in women in their late 40s to early 50s, but it can happen earlier or later. Menopause is confirmed after a woman has gone 12 months without a menstrual period. The transition to menopause, known as perimenopause, can start several years before the actual menopause and involves changes in the menstrual cycle, hot flashes, night sweats, and other symptoms. Hot flashes are one of the most common symptoms of menopause. They can cause a sudden feeling of heat, sweating, and a red, flushed face. Hot flashes can be uncomfortable and disruptive, but there are ways to manage them. Dressing in layers, keeping the room cool, and avoiding triggers like spicy foods, caffeine, and alcohol can help. Some women find relief through hormone replacement therapy, HRT, which can help balance hormone levels. Night sweats are similar to hot flashes, but occur during sleep. They can disrupt sleep and lead to fatigue and irritability. Keeping the bedroom cool, using breathable bedding, and wearing lightweight pajamas can help. If night sweats are severe, it's important to talk to a healthcare provider about potential treatments. Mood swings and changes in emotional well-being are also common during menopause. Hormonal fluctuations can cause irritability, anxiety, and depression. Regular exercise, a healthy diet, and stress management techniques like yoga and meditation can help improve mood. It's also important to seek support from friends, family, or a mental health professional if needed. Vaginal dryness and discomfort during intercourse are other common symptoms of menopause. This can be due to decreased estrogen levels, which affect the vaginal tissues. Using water-based lubricants or vaginal moisturizers can help alleviate discomfort. Hormone therapy may also be an option for some women. Bone health is another important consideration during and after menopause. Decreased estrogen levels can lead to bone loss and an increased risk of osteoporosis. To maintain bone health, it's important to get enough calcium and vitamin D, engage in weight-bearing exercises, and avoid smoking and excessive alcohol consumption. Bone density testing can help assess bone health and the need for treatment. Heart health is also a concern for postmenopausal women. The risk of heart disease increases after menopause, partly due to changes in hormone levels. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing stress, can help reduce the risk of heart disease. Regular checkups with a healthcare provider can also help monitor heart health. Hormone replacement therapy, HRT, is one option for managing menopause symptoms. HRT can help alleviate hot flashes, night sweats, vaginal dryness, and other symptoms by replacing the hormones that the body no longer produces. However, HRT is not suitable for everyone and can have risks, including an increased risk of certain cancers and heart disease. It's important to discuss the benefits and risks of HRT with a healthcare provider. Lifestyle changes can also play a significant role in managing menopause symptoms. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help support overall health. Regular physical activity, including both aerobic and strength training exercises, can improve mood, maintain a healthy weight, and support bone and heart health. Herbal remedies and supplements are sometimes used to manage menopause symptoms, but it's important to approach these with caution. Some supplements, like black cohosh and red clover, are thought to help with hot flashes and other symptoms, but their effectiveness and safety are not well established. It's important to talk to a healthcare provider before starting any new supplements. Sleep is another important factor in managing menopause symptoms. Good sleep hygiene practices, such as maintaining a consistent sleep schedule, creating a relaxing bedtime routine, and avoiding screens before bed, can help improve sleep quality. If sleep problems persist, it's important to talk to a healthcare provider. Menopause can also affect sexual health and intimacy. Changes in hormone levels can lead to a decrease in libido and sexual satisfaction. Open communication with a partner, exploring new ways of being intimate, and seeking support from a healthcare provider or therapist can help address these changes. Now, let's talk about premenstrual syndrome, PMS, which affects many women of reproductive age. PMS refers to a group of symptoms that occur in the 1 to 2 weeks before a woman's period. These symptoms can include mood swings, bloating, headaches, fatigue, and breast tenderness. While the exact cause of PMS is not known, hormonal changes are thought to play a role. Managing PMS symptoms often involves a combination of lifestyle changes and medical treatments. Regular exercise, a healthy diet, and stress management techniques can help alleviate symptoms. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help with physical symptoms like cramps and headaches. Hormonal birth control can also help regulate hormone levels and reduce PMS symptoms for some women. Dietary changes can also help manage PMS symptoms. Reducing salt intake can help with bloating and water retention. Eating small, frequent meals and avoiding caffeine and alcohol can also help manage symptoms. Some women find relief from supplements like calcium, magnesium, and vitamin B6, but it's important to talk to a healthcare provider before starting any new supplements. Emotional and mental health support is also important for managing PMS. Practicing relaxation techniques like deep breathing, yoga, and meditation can help reduce stress and improve mood. Talking to a therapist or counselor can also be beneficial, especially if PMS symptoms are affecting daily life and relationships. In addition to PMS and menopause, there are other women's health concerns to be aware of. Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects women of reproductive age. PCOS can cause irregular periods, excess hair growth, acne, and weight gain. It can also affect fertility. Managing PCOS often involves lifestyle changes, such as maintaining a healthy weight, eating a balanced diet, and getting regular exercise. Medications, such as hormonal birth control and insulin-sensitizing drugs, can also help manage symptoms. Endometriosis is another common condition that affects women's health. It occurs when tissue similar to the lining of the uterus grows outside the uterus, causing pain, heavy periods, and fertility problems. Treatment for endometriosis often involves pain management, hormonal therapies, and, in some cases, surgery. Fibroids are non-cancerous growths that develop in or on the uterus. They can cause heavy periods, pain, and fertility problems. Treatment options for fibroids include medications to manage symptoms and reduce the size of the fibroids, as well as surgical options to remove them. Cervical health is also an important aspect of women's health. Regular Pap smears and HPV testing can help detect cervical abnormalities and prevent cervical cancer. The HPV vaccine is also an important tool for preventing cervical cancer and other HPV-related diseases. Breast health is another key concern for women. Regular breast self-exams and mammograms can help detect breast cancer early when it is most treatable. It's important to be aware of any changes in the breasts and to report them to a healthcare provider. Osteoporosis is a condition that affects bone health, causing bones to become weak and brittle. It is more common in women, especially after menopause. Maintaining bone health through a balanced diet rich in calcium and vitamin D, regular weight-bearing exercise, and avoiding smoking and excessive alcohol consumption can help reduce the risk of osteoporosis. Bone density testing can help assess bone health and the need for treatment. Heart disease is the leading cause of death for women, but it is often overlooked as a women's health concern. Risk factors for heart disease include high blood pressure, high cholesterol, smoking, diabetes, and a family history of heart disease. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing stress, can help reduce the risk of heart disease. Regular checkups with a healthcare provider can also help monitor heart health. Mental health is another important aspect of women's health. Women are more likely to experience depression and anxiety than men. Hormonal changes, life events, and social factors can all contribute to mental health issues. Seeking support from a mental health professional, practicing self-care, and building a strong support network can help manage mental health concerns. Pregnancy and reproductive health are also key aspects of women's health. Prenatal care is essential for a healthy pregnancy and includes regular checkups, screenings, and vaccinations. It's important to follow a healthy lifestyle during pregnancy, including eating a balanced diet, staying active, and avoiding harmful substances. Postpartum care is also important for the health of both the mother and baby. This includes physical and emotional support, as well as monitoring for any complications. In addition to physical health, sexual health is an important aspect of women's health. This includes practicing safe sex, getting regular screenings for sexually transmitted infections (STIs), and having open and honest communication with sexual partners. It's also important to seek support for any sexual health concerns, such as pain during intercourse or changes in libido. Access to healthcare is a crucial issue for women's health. Regular checkups and screenings can help detect health issues early and prevent complications. It's important to have access to a healthcare provider who understands women's health concerns and can provide appropriate care, and support. Advocating for yourself and being proactive about your health is essential. This includes being informed about your health, asking questions, and seeking a second opinion if needed. It's also important to be aware of your rights as a patient and to seek support from patient advocacy organizations if needed. Overall, women's health is a complex and multifaceted issue that requires attention and care. By staying informed, maintaining a healthy lifestyle, and seeking support when needed, women can take control of their health and well-being. Thank you for joining me on Banana Life. I hope you found this information helpful and empowering. Women's health is a crucial topic that deserves more attention and understanding. By taking care of your health and advocating for yourself, you can lead a fulfilling and healthy life. Remember, you are not alone, and there are resources and communities available to support you on your journey. Stay positive, take care of yourself, and I'll see you next time.